before I ask you.
There.
Yeah, we're missing a dare.
A dare. Okay. I have 3 o'clock. So we will go ahead and get started.
You want to come closer, or you can sit here?
I hope Adair County joins us in a few minutes. I appreciate the members of the media being present this morning. I'm not sure if you're there representing the newspaper or the radio. I made a comment this morning that it would be difficult to use the newspaper because this situation is evolving quickly and the information changes so quickly. What I was meaning when I said that was if using the newspaper to give immediate updates would not be real good, but there is ways the newspaper can certainly help us by, printing what people can do to protect themselves. And, we'll go over that in a few minutes. So that would be very helpful. And if you're a member of the radio, if you will, I'm going to show you here on my computer screen. Are you all seeing the Google screen?
Sean, we have some people here that would like for you to introduce yourself.
All right, I will do that. My name is Sean Crabtree. I'm the Executive Director of the Lake Cumberland District Health Department, and I certainly appreciate you all joining us today. What I want to do is I want to show you on our website where the best place to get current information is, and then we'll start. So I'm going to try to share my screen here so you can see this. You should now be seeing our website. That's at lcdhd.org. When you first go to our website, you'll see the coronavirus banner as the first thing. If you click that, we're updating information there. So we're linked to the CDC's website. We're linked to the Kentucky COVID-19 site where they're updating information. I just uploaded this that the CDC put out, a guide for individuals and families, schools and child cares, assisted living facilities, and so forth, faith-based organizations like churches and so forth. So for like the newspaper, there's probably a lot of really good information in this particular handout that you could use to find some guidance for individuals and families, for schools and child cares and so forth. And also on this page, we're keeping up with how many cases there are right now. We have, that we know of, 8 in the state. We're getting that from the Kentucky website right there that still says 8. If you need quotes or an interview, you can certainly contact your local health department there in your county, and they'll get the information to the right person. We will try to accommodate those things as best we can. We would certainly encourage you to first look on our website and see if you can find what you need there. Let me begin by saying there are no confirmed COVID-19 cases in Lake Cumberland at present. There's no confirmed cases. Lake Cumberland makes up Adair, Casey, Clinton, Cumberland, Greene, McQuarrie, Pulaski, Russell, Taylor, and Wayne. In none of those counties right now do we have a confirmed COVID-19 case. We have had some folks tested. We don't test them local. The test kits are with the state lab, or I think the private labs are going to start testing. But samples are taken locally and submitted, and usually the turnaround time is around 24 hours. But there is no confirmed cases of COVID-19 in Lake Cumberland at this moment. Here's some things that Lake Cumberland has done. On March the 2nd, we activated our Department Operations Center. That's how that we internally coordinate the different divisions of our agency so that we can have a coordinated response. We have our environmental staff, our medical staff, nursing staff, epidemiologists, health educators, and so forth. We have the various department heads in those branches meeting together to coordinate our efforts. We've also been updating our website and our social media regularly. Our website is the quickest way, and our social media is the quickest way we can get information out. So we're not trying to go around the media, of course, but this situation is evolving so quickly, it's changing sometimes hourly. And we're just a few people, and there's a lot of newspapers in our district and a lot of radio stations in our district, and it would be very difficult for us to call each of you. Now, I know Amy has, I believe, all of your contact information, and maybe we can start shooting you all out some email updates or some updates through another avenue, so you can be making radio announcements or having material for your newspaper. So we'll try to do a better job with that if we've not been doing a good enough job already. We have been also fielding a tremendous number of telephone calls. There's been a lot of phone calls of rumors that people think someone down the road has it, or someone at school has it, or someone at the hospital has it. So far, there's no confirmed cases in Lake Cumberland, so the rumors are unfounded at this point. Do I think we will get cases in Lake Cumberland? We probably will. Hopefully we won't, but this is a virus that's spreading pretty aggressively. It's the COVID-19 is in the coronavirus family. Sometimes there's certain coronaviruses that when you catch them, you don't start becoming contagious until you're already sick and showing symptoms. With this particular COVID-19 virus, you become contagious before you're showing symptoms. So it's very difficult for us to identify who's sick and isolate them before they become contagious, because they're contagious before they're showing symptoms. That's the reason why, since there's no vaccine developed right now, the only things that we can really do is encourage people to wash their hands. If they're coughing, to cough into their elbow or to cough into a handkerchief. If they're feeling sick, to stay home, to observe social distancing, to try to, in other words, try to avoid social gatherings in enclosed places as much as you can. When you're going out, try to stay as far away from people, 6 feet if you can. I know these are difficult things to do, but those are the things that we can advise at the moment. This particular virus, as I understand it, seems to be impacting individuals differently based on their age. Most children who contract the virus, generally speaking, don't show illness, even though they do have it and are contagious. Middle-aged folks and down, in many cases, they will have mild symptoms, maybe feeling sort of like a cold or something. They are contagious. They've contracted it. They may not have a lot of symptoms, but they are contagious. The folks we're worried most about, or the individuals we're worried most about, are those over 60, those with heart, lung, and kidney disease, or those with diabetes, those with compromised immune systems already. Because if they catch it, there's a much greater chance that they will have a severe reaction to it. This thing is spreading pretty rapidly. It is, once you catch it, at least for those who have compromised immune systems, it's somewhat more deadly, if you would like to say, than maybe the common flu or the standard flu. So we want to try to protect our elderly and those who have compromised immune systems by making sure you're washing your hands and trying to social distance and trying to cover your cough and staying home if you're sick, and so forth. The last thing I think I will say is that we have been, or we expect this to hang around for a while. It's probably not something that's going to pass by quickly. We're hopeful that maybe when the summer months come, it may behave like some other viruses and be seasonal. We don't know for sure. We'll wait and see. It will still probably be with us for several months. So that's the comments that I have. Amy, is Amanda going to present next?
Yes, Amanda has a statement, I think, some case count numbers and things like that.
Okay. Amanda, can you unmute yourself and make your statements, please? And you may want to turn the camera towards you while you're talking. Thank you.
All right, I apologize. My camera is not in the best angle. So, my name is Amanda England. I am the regional epidemiologist with the Lake Cumberland District Health Department. And I was just going to give you some basic information. Mr. Crabtree, our executive director, has already shared a lot of the information. But as he said, there are different types of coronaviruses. The common cold, you may have heard of MERS and SARS. Those are all types of coronaviruses. This specific coronavirus disease 2019 is a new and what we call novel coronavirus, and it is often referred to as COVID-19. There is no vaccine currently for COVID-19, and there's also currently no antiviral treatment. For example, influenza, there are antiviral treatments such as Tamiflu that you can take. There's currently no antivirals for COVID-19. Some basics, the most common symptoms of COVID-19 are fever, cough, and shortness of breath. And those can develop anywhere from 2 to 14 days after exposure from a case of COVID-19. That it is a respiratory virus, so that it is spread through droplets. When people cough or sneeze, it is spread from those droplets. That is why we advise the 6 feet close contact, limiting to 6 feet between each other. In Kentucky, there have been 8 cases, as you may be aware. That is the current case. That is the current case count as of today, with 5 being in Harrison County, 2 in Fayette County, and 1 in Jefferson County. As Mr. Crabtree said, we have no cases in Lake Cumberland. There have been some tests done, but those test results were negative. In general, we are advising the public, if you are concerned that you may have been exposed to COVID-19 or you think you may have COVID-19, we're advising you not, the general public, not to just show up at your provider's office or the hospital. We're advising them to call ahead and talk with their provider, and so that they can screen them and talk to them and see if they should be seen in their office, if they should be referred for testing. So again, we are asking the general public to call ahead and not just show up in the provider's office. And that is all I have. Amy, is there anything else you would like me to address?
No, I think that covers it, Amanda. Thank you. That's a good overview.
I think Stuart, our environmental director, has some things to say. He's here with me. I'll turn the camera toward him and hand him the microphone.
My name's Stuart Spillman, environmental director with the health department. I just wanted to address a couple of things. In your packet that the media has, you have 3 links. You have a link for environmental household cleaning. You have a link for facilities cleaning, which would be something like a school, office, community center. And you also have a link to the EPA's registered products that will kill the novel coronavirus. In those links, you'll be able to read and find out all the ways that people can use household products to kill that virus if they come into contact with that. And if you'd have any questions about any of this cleaning, please just contact me at my office here in Somerset.
Thank you, Stuart. Amy, is there anything else in the packet that you would like to describe?
I was just going to go over the contents of that. Can you hear me okay?
I hear you.
Okay. I'm going to go over the contents of the packet just so you all are familiar with what we're handing out. The things on the right-hand side of the packet we intend for public information. So if you want to share that information, feel free. You can make copies, distribute. You can use it for space in newspapers or share it in your offices, whatever. So the first page is just general guidelines and tips, some of the things Amanda talked about and some of the things that Stuart and Mr. Crabtree have both talked about. Signs and symptoms and how to how to protect yourself in the community. The second document there is something that you may see like in a triage area at a doctor's office or something. It talks about risk factors and when you should be seen and those kinds of things, prevention tips. The next document is some action items that the general public can take, things they can do to protect themselves, preparation activities, those kinds of things. And then the next two pieces are the cleaning and disinfecting resources that Stuart just mentioned. So those are the links there to the correct web pages. And then the last document there that's stapled together is the EPA approved list of disinfectants and cleaning products. On the left-hand side of your packet is the public information contacts. That's the staff that we have at the health department who is available to take your calls and try to accommodate the things that you need. So they're broken out by county so you can see who is assigned to your county and your location. The last piece there on the left is a ReadyOp registration form. ReadyOp is the system that the health department uses to notify staff and partners of potential events, or we're going to release guidance and things that way. So if you want to become a contact with the health department and receive the things that we're sending out, I encourage you to go ahead and fill that information out and get that back to us, and we will make sure to include you in things that we're sending out from time to time. The only other thing I wanted to mention was that this morning we coordinated and offered community planning sessions in all 10 of our counties with stakeholders and partners. So those were done. We did the same thing or similar thing here this morning as what we are doing with you all now. So we did a Zoom and we had facilitated discussions where we talked about needs that the partners have, if they need additional guidance, if they have other identified needs, to try to figure out how the health department can best address their concerns and help them to prepare. So those went really well. We had significant interest in those in the counties and a lot of good feedback and the participation from those in attendance. And I think that's it. I wanted to make sure if you all have questions that we provide time for you to ask anything. Moving forward, we may continue to offer things like this via webinars and Skype type options. We are also willing to consider things like YouTube Lives and Facebook Lives and some of those types of events and things. So the best thing you can tell us is how you think the best way to communicate with your public is going to be. So if you have ideas that we can incorporate, we're willing to listen to those.
And I would like for all of you to provide to your moderators there your contact information. We have a media officer here that we'll do our best to get out information to you guys by way of email, and we'll do our best to try to accommodate any kind of interviews or things that you want, understanding that we're limited in number and under high demand right now. I would always advise to go to our website first to find information in the state website and the CDC. So with that being said, we'd like to open the floor up for questions. If you want to ask a question, let your moderator know. Come up close enough to the microphone that we can hear you, and then we'll let one of our folks try to respond to your question. So if you want to ask a question, just come forward and let's see if we can make this happen.
Sean,
Yes.
this is Kim and Casey. We have a few questions from our radio station.
All right, thank you.
Hi, Sean. Rick Wesley. I had gotten on the COVID-19 site, and I was looking for some pre-recorded announcements. I noticed that there were all kinds of videos. There were JPEGs and things. Are you aware of any pre-recorded PSAs?
No, I am not, but that's a very good recommendation, and I'll pass that along to the state operations center that's something we might need. So pre-recorded radio.
Yeah, and if they don't have that or what, and that would be a good idea. Get back with us here in Casey County, and between the two stations, we can come up and record you something and actually send it to you by email.
Rick, I'm going to contact you. This is Amy. I'm going to contact you about that. I think that's a great idea, and that would help a lot. Thank you.
Okay,
And it would
thank
be
you.
really good if the state would go ahead, I mean, because every county in the state's going to need what I would call PSAs. And if they had just some pre-recorded public service announcements, that would be really good. So thank you for that suggestion. Who else has a question?
We have a question. Oh, sorry. Go ahead.
Still got one in Casey. Go ahead, sir.
Okay, my name is Charlie Van Leuven. I'm with the Casey County News. I had a question. You said something about seasonal. Does the health department or does the CDC have any indication that this will be something that comes back around on a yearly basis? Or, you know, if the cold virus is also a coronavirus, this is also highly contagious. Is there any indication that we'll be seeing this again next year?
I will let either my preparedness coordinator or my epidemiologist respond. They're probably better qualified professionally to answer that question. In short, it's a new virus, so we don't know exactly what it's going to do, but maybe they can tell you how some other coronavirus have behaved in the past and may give you some idea. So Amy or Amanda, would you like to tackle that?
Amanda, are you still on? The things, I'll start, and then if you want to chime in, the things that I have been told and have received information about is that during the summer months, people are typically outside more, not as much in close contact. So it kind of doesn't have the opportunity to spread as fast and replicate as fast. And then also the temperature going up has a lot to do with it, and the sunshine and some of the weather conditions and things. People are indoors more in the winter, and the temperatures are lower, and the viruses like to replicate quicker in colder temperatures. So the heat is a good thing, and usually, like you said, normal colds and things are lessened in the summer, and that's what he's saying when he says seasonal. I don't know that certain viruses ever truly go away, but they wane a little bit, and you don't see them as often, and then, you know, they may flare back up when people are in closer contact again. That's the things that I have been told and seen. Do you have a difference, Amanda?
Would echo your all's comments, and just remember that this is a new novel virus, so we really don't know how it will behave. Just based on the other viruses, there are some assumptions.
Thank you. I'm sorry, I wish we had clearer answers, but there's only so much you can know about something that's new. Okay, next question, please.
We have one in Adair.
All right, Adair County, could you get closer to the microphone, please?
How about here?
Yes, I hear you.
Awesome. Hi, I'm Drew Bergman with the Adair Progress. I just have a quick question. The NAIA, which is home to Campbellsville University and Lindsey Wilson, has canceled their postseason. I'm already getting reports of high school athletics at least shutting down for the weekend, canceling practices. Lindsey Wilson's gym has taken preventative measures there. I was wondering if there's anything you're disseminating down to schools and universities in the area, even though we do not have any reported cases yet.
We are communicating with the superintendents along with the representatives from the state's health operations center is communicating with the superintendents for at least the high schools. I'm not sure about universities. Amy, I'm sorry, do you know more about that than I do?
I think all of the universities in our area were invited to attend our meetings this morning, and I don't know about participation. I've been in Campbellsville all morning. I know Campbellsville University, I'm pretty sure, was represented at the meeting I attended. There was quite a few in attendance, so I don't know every single person that was there, but they are receiving information and guidance from them, from us. And then our epidemiologist, Amanda, shares clinical guidance with nursing staff and infection preventionists at the universities, as well as the hospitals and our clinics in our area. So they are receiving guidance specific to, you know, all types of the virus, not just about closures and things like that, but they're getting guidance from us regularly.
Thank you.
You're welcome.
All right, who else would have a question?
We have one more.
Go ahead. Where are you?
Adair
Right here.
County.
Oh, okay. Hello.
Hello, I'm Anna Buckman with the Adair County Community Voice newspaper. We were wondering if there is a positive case in any of the counties, would we hear that from you all, or where would we find out that information?
We would post that immediately on our website, and we would post it on social media. I guess too, we can do a better job of getting that stuff out to the newspapers and radios. I think when we have our Department Operations Center meeting on Monday, we'll talk about some strategies to make sure we're getting you all emailed information so you can do your reporting. So, but I know for sure we would post it on our website and our social media right away.
Thank you.
I want to mention too, Sean, that Governor Beshears has been doing those daily briefings. You all have seen those, I'm sure. He is offering that information almost in real time. I mean, they get those test results back, and then he's sharing that in a very timely manner. So, we have an obligation when we do a notification, when we receive a positive, if we received a positive, that we would notify our healthcare providers and those who had a stake in that specimen or that case first and foremost. So by the time we make those notifications, the governor very well may have already made a press release about that. So I don't discourage you from following Governor Beshears. He is certainly doing his best to keep everyone up to date and provide information in as timely a manner as he can. So I would certainly advertise or recommend, I guess, that you all follow him also, and we will certainly do our best to let you know the moment we can.
All right. Who else has a question?
One more from Adair.
One more from Adair. Come on in.
I'm Jan Royce from 92.7 The Wave radio station. In answer to the recorded PSAs, the National Association of Broadcasters actually released a 30-second and 15-second recorded PSA this morning. It's very general, but just giving information on that you should be washing your hands, the same types of tips that most everyone is giving, but I did want to share that. And then also I was wondering, as is pretty common with the flu, you can get a negative result and then a few days later get a positive result. Is there any indication that the people who have tested negative could possibly have a positive result in following days?
It depends on how much of a viral load they have at the moment when they're tested. Yes, it is possible to test negative and a few days later to be positive. The virus would multiply in your system and, produce a high enough viral load you would test positive a few days later. It's also possible to not have the virus and then contract it a few days later and later test positive. So I guess that answers your question. It is possible.
Okay, thank you.
Amanda looks like she's going to add to my comment. Amanda?
I don't have anything to add, but there is a question here in Cumberland, and I'm on.
Okay. I figured I said something wrong and she was going to fix me. All right, what's going on in
Neil Poindexter, WKYR, you're in Cumberland County. Since we are located very close to Tennessee, Clay County in particular with Cumberland County, is there someone monitoring in case we had a case, say in Casey County, that we should be aware of along the border here?
I'm not sure how much the state of Kentucky is communicating with the state of Tennessee. I've not heard that in the reports. Maybe Amy or Amanda might know something I don't know. Do you know, Amy?
Amanda and I both are contacts in the Tennessee Health Alert notification system. So we receive guidance and information on Tennessee from time to time. And we also have a cross-border notification plan in place where we share information on our border counties that may result in overflow or concern for the state that neighbors us. So yes, we do have plans in place, and we have contact information in place for those who would be our counterparts across the Tennessee line.
That's a good thought. It wouldn't hurt for us in our planning efforts to reach out to those contacts and remind them that they're in place and we may need to use them. So that might be something we want to put on our to-do list.
Did that answer your question, sir?
Yes, one other, just a comment. Connie Crabtree, our local station owner at WKYR, has offered our recording facilities for a PSA. And I think that PSA, if it's coming from the local, we recognize voices and things like that,
Yes.
that would be more than coming from national.
I agree. I think local is always best. Thank you, sir.
I always value the federal feedback and I value the state feedback, but what's going on in Lake Cumberland may be not exactly what's going on in Frankfort. So it's good to get the information drilled down as closely to home as you can. So I agree with that. Other questions?
Juan, we have a question.
Well, let's see.
Question here in Taylor.
Someone at Melanie Jones' side has a question. So I'm not sure. I see Sam. So Sam.
Yes, Pulaski County.
Pulaski County. All right.
Hi, this is Carla Slavey from the Commonwealth Journal.
Yes.
We've been hearing a little bit of concern from other places about whether if there was a run on cases that it might overwhelm the medical system, or it might take a lot of the local resources, that it may actually lead to issues with running out of supplies. Is that sort of a problem for our area, do you know? Or
I know that we would encourage people not to go to the hospital unless you're actually sick. We don't want to overwhelm our medical system. We want them to be available to treat the people who are sick. You always get the concern, or we always have concern about the worried well, the people who are actually well but just worried, and that they will overwhelm the system, and the people who are actually sick are encumbered from getting care because they're having to wait in line with the people who are just worried. So the hospitals, they have planned for this eventuality, and hopefully they've planned well. I know Amy works closer with them on that planning than I do, so I will allow her to make some additional comments. Amy?
Like you said, the hospitals and the healthcare centers do have plans in place, and they regularly exercise those. The state has also given guidance on conservation of PPE, so they're encouraging them to think of how to manage
protective equipment, PPE.
Yes, personal protective equipment, masks, gowns, gloves, those types of things. And they're giving them guidance on how to conserve that and make it go farther and stretch it, and when the best situations are to use certain things and that type of thing. And there's also a resource request process in place with the state, so that if facilities are starting to run low on things, there's already a process in place of how they would notify someone at the state and potentially get on the list, to start receiving additional resources.
Thank you.
Amy, did that answer you, Carla?
yes, thank you.
Amy, you had a question at your location?
Yes, we have questions here in Taylor.
All right.
I'm John Moore from the Central Kentucky News Journal. I've got a few questions. Something that a lot of people have been asking about is the idea of a disruption to their daily life. People do not want to give up sporting events. They definitely don't want to give up church. Can you or somebody on this call explain the rationale behind canceling public gatherings and asking people to practice social distancing? Because that's something that people seriously have taken issue with.
This virus is spread through droplets. When people cough or breathe and release droplets, it can live in the air and live on things for several hours before it dies. So, and as I said earlier, for this particular virus, if you have it, you are contagious before you feel sick. So you're out there spreading it before you feel sick. Now, even though in most circumstances, it doesn't impact the middle-aged people and the younger-aged individuals. In most cases, they don't get severely sick. They are still spreading it. And if a child brings it from childcare home and they pass it to their family, and their family goes to work and passes it to the people they work with, and so forth, it eventually is going to make it back around to the people we're trying to protect the most, the elderly and those with compromised immune system. So the logic of social distancing is to decrease the chances that you're going to get it, and therefore decrease the chances that you're going to spread it. And I understand, none of us want in our independent area where we're very independent, stubborn people that want to do what we want to do. That's a difficult thing to ask people to do, to curtail their normal activities. And I would just say all we can do is tell you what's best practices. Stay home if you're sick, wash your hands, cough into your elbow, try to avoid crowds in enclosed places as much as you possibly can. We're just trying to decrease the odds you're going to get it and spread it. So that's the logic. I was watching on how some of the churches are responding, and again, it's the same situation. When you're in church, you're in an enclosed space with a group of people for an extended period of time. It's spread by droplets. Even if you are cleaning the building and you're not shaking hands and you've got hand sanitizer, well, it's still spread by droplets. And maybe even if you're encouraging the elderly and those with compromised immune systems to stay home, if you spread it within the building and those people go and spread it and then they go and spread it, it's eventually going to work its back way around to the people we're trying to protect the most. So I hope that makes sense. Amanda or Amy, would you like to add on to what I have said or clarify anything I've said?
No, I just think that's containment, the successes that we've seen in other countries, and that's where we try to learn some of our lessons and how to handle things here in America, has been the limitation of some of the activities. And that's a hard thing for Americans to realize and to handle because of our freedoms and the things that we enjoy here. And we certainly don't want to infringe on that, but we also want to contain this illness as much as possible. So the successes that they've seen in other countries like China and some of those where it's lessening now and the worst of the waves seem to have passed is because of some of the measures like this that they've taken. So.
All right,
Yeah.
other questions?
Another question? That was, oh, for sure, I definitely did. I apologize. But, okay, so that was a really good answer. The issue that I've run into, of course, you all mentioned that you use social media to post stuff and get it up there as quick as possible. A lot of people that I've seen on social media, of course, I'm 22, are younger. They're not in the demographic that is most likely to suffer from this severely. I mean, how do we get them to care that they could be spreading this to somebody else who could be immunocompromised or have an underlying illness or is elderly?
Well, I think we share with them truth as the research and the truth as we understand it today, as often as we can, and just reinforce as often as we can, good health practices. It's always a good idea, regardless of the coronavirus or not. It's always a good idea to be washing your hands. It's always a good idea not to be coughing into your elbow and things like that. So I mean, there's things that we just need to try to impress upon people as often as we can until maybe it digs in that's important. I don't know, maybe for some people it doesn't hit home until it hits home, and it'll get important when someone down the road has it. I don't know, but I don't know how you motivate people. I wish I knew how to encourage people to exercise and to eat better and to not smoke and all of these things that cause all the health problems that public health wishes we could do something about, so that Kentucky wouldn't rate in the bottom of the nation in all of this stuff. So, the good news is right now in Lake Cumberland, there's no confirmed cases. So maybe we'll get lucky. Probably we won't be so lucky as to avoid this completely, but we certainly need to keep telling people, you need to treat this as if it's serious and try to do some things to prevent the spread of it so that it's not getting back to the people we're trying to protect.
Okay. And then another question that I think might go best towards Miss England.
All right, Amanda, be ready.
Nice to finally talk to you in person, by the way. The interview that you did was fantastic, and people have said nothing but good things. So you're doing a great job. So my question is kind of, can you give us a sense of the scale of this issue? Something that a lot of people have been talking about is, why should we worry about this when only, what was it, 38 people have died in the US so far? Only a few thousand people have gotten it so far. Of course, I know that there are some issues with the limited testing that suggest that we don't have the full numbers of how many cases people have had in the United States. Is there any way you could kind of give me, as an epidemiologist, sort of a sense of scale, how big this could be, how seriously it is currently, and kind of just give people a sense of why we're working so hard now to keep it from spreading further?
Great. Thank you so much for your kind comments. I think it is still very early to see how exactly this is going to spread in the U.S. You are exactly correct. We don't know the true representation, unfortunately, right now, due to the number of testing that is being done. It is very limited still. So we don't know a true picture of what is exactly going on. We are, as Mr. Crutcher was talking about, we are trying to limit the number of cases, asking churches to postpone, cancel events. But it is spread much like the flu, as you've probably heard, through droplets. So I feel that it has the potential, to spread and be as large as the flu. It really depends on, how well people are adhering to those guidelines, really, of staying home when they're sick. So it's really hard to determine what this picture is going to look like, honestly. That's really the best I could do.
The flu every year kills about 1 or 2 or 3%, 1 or 2% of the people that get it. This is more dangerous than the flu. So it's going to impact a considerable number of people before it's over. So trying to avoid it would be good. Particularly even if you don't get that sick from it, you may spread it to someone who will get very sick from it. So trying to avoid spreading it as much as we can. Other questions?
I think the containment issue too is you look at the numbers of cases of flu that we have confirmed every year, and they're in the millions, the number of cases. I'm not talking fatalities or deaths from flu, but just the number of cases. And that's with a vaccine available. This strain of COVID does not have a vaccine available now. So I think that's the concern to a lot of public health, and why we want to get ahead of it on the front end as much as we can, because there is no vaccine available, and we don't want those numbers to get to the flu levels, that we're seeing.
Yeah, thank you. So of course, I know Miss England talked a little bit about testing capacity being limited. I know that there are testing criteria in place that the state of Kentucky looks at before determining whether or not somebody should be tested for COVID-19. Is there any way to kind of maybe quantify that? Maybe give the hard details of what exactly they're looking for in a patient when they decide to expend one of those test kits to test that person?
That's probably an Amanda question.
Okay, yes. CDC updated. Originally, they had certain criteria, like 3 different criteria that a person would have to meet to be tested. That has now been removed, and basically it is clinician discretion to contact your Department of Public Health to get someone tested. At the state level, what they're looking at, have you had recent travel to those affected areas with sustained transmission? And there are 4, China, Italy, Iran, South Korea, and they're looking, have you had travel to there? Do you have symptoms? Also, they're looking at, are you a close contact of a confirmed case and have symptoms? They're also looking at, do you have signs and symptoms? You had negative test results for everything else, for example, like influenza. You are hospitalized with pneumonia. Those are all things they take into consideration when they consider testing someone. And that is done on a case-by-case basis. Does that answer your question?
Yeah, that answers the meat of it. Something that I think a lot of people have been kind of thinking about. I know that Mr. Crabtree mentioned the worried well. Of course, not everybody who thinks they have COVID-19 can be tested because we don't have enough tests for that. Do you, I mean, this might be something you have limited knowledge of just here in the district, but do we foresee the testing capacity of the United States being able to ramp up to accommodate additional tests?
I can say, and after this question, we're going to have to let some of the other sites answer some questions. There's people I can see at the screen wanting to ask some questions. The private labs, the 2 largest private labs, are getting ready to start testing also. So the capacity to test is going to expand dramatically. If it hasn't already, is getting on the verge of. So the ability to test, instead of being a decision between the provider and the patient and the state, it'll be a decision between the provider and the customer, the patient, and they can just order the testing through the lab. So the testing will be much more widely available anytime, if not already. Let me take a question from Casey County, and then I'll take a question from Adair County. You're still muted, Casey. Oh, there you are.
Okay, here we go.
Jerry Atwood from WKDO 98.7 The Buck. Could you touch on the incubation period time, and once you get this virus, what would be the course? I mean, if it has to run its course, what kind of time frame are we looking at as far as, I feel much better now? And also, if it's respiratory, are people who are like smokers, vaping, are they at more risk than the general public?
Yeah, I think Amanda would be best to answer both of those questions.
Amanda, Laura is here also if you need her support. We have our director available.
I can't see her, so I didn't know she was there.
Yeah, she's here with me. Sorry, she's on the other end of the table, but she's here.
All right, great. Thank you. Please ask your first question again.
Okay, I was wondering if you could just touch on like the incubation period, like from the time that you're exposed to this till you start feeling the effects of it, and as far like what kind of duration are we looking at if it has to run its course?
Yes. Okay, so from time of exposure to developing symptoms is roughly 2 to 14 days, with the median being 5 days. Researchers show the first symptom people tend to get is cough, then fever and shortness of breath. Those who have underlying health conditions, as Mr. Crabtree already addressed, lung, heart, kidney, are more susceptible and can have a harder time with the illness. So potentially, I haven't seen anything specifically about smokers, but I would assume that just because they usually have shortness of breath, things like that with smoking, that it would be similar, but I've not seen any official documentation about that.
Thank you, Charlie. And I had one question. Charlie Van Leuven from the Casey County News. I had a question about the availability of testing kits and if you guys had a timeline as to when they would be more widely available so that you don't have to wait for somebody to show symptoms before you're able to test them and kind of help you contain it.
So far, the state has had all the kits it's needed. They've not run out yet, and the private labs will be testing too. So it doesn't look like we're going to. Now, test kits are something that's kept at labs. We don't keep them at the health department or at the hospital. We take the sample and we submit it to the labs, and the labs test it and give us the results. So the state lab has enough test kits available to be testing. They're turning those around in about 24 hours. And then the private labs will be getting in on the game. If they're not already approved and up and going, it's going to happen anytime. So I don't think testing is going to be an issue. Of course, we don't want to bog the system down with unnecessary tests.
Mr. Crabtree, Laura's here and she has a comment too about the testing.
Okay, Laura, go ahead. All right, this is Laura's our director of nursing.
This is just because someone wants testing, though, they won't be able to get that, or even with a provider, the labs will be deciding what tests they're going to run, as well as the state lab. There's going to be criteria that has to be met to get testing. Otherwise, they're going to get bombarded with tests.
Makes sense.
Thank you, Laura. I know we have a question in Adair County.
After watching all of this for several days, I haven't seen anything mentioned, but are there any indications about our food supply, anything that we should stay away from regarding a lot of fresh fruits and vegetables come from California, Florida, other places where there are positive test results? Are there recommendations about food for
I'm going to let the environmental director answer that.
There's no indication that coronavirus would spread as a foodborne illness, but we would, of course, we always recommend that you wash your fruits and vegetables before you eat them. So that would be the best practice to of course wash your fruits and vegetables.
Thank you. What other questions do we have?
We have a question in Russell.
Okay, Russell, go ahead.
Hi, I'm John Thompson with the Lake Cumberland Current, and I just wanted to encourage actually maybe a liaison from the office to provide maybe a weekly newspaper-friendly update of information, provide answers to continuing questions. That way you don't have 20 different voices maybe having different information and that sort of thing that can come straight from you all.
Yeah, I think that's a good idea, and I intend to discuss local media communications at our Department of Operations Center Monday, so we'll come up with a better strategy. If you all would, make sure you get your contact information there to the local moderator so they can get that turned into us. And if we get a sense that we need to have more of these types of meetings, we will do that also and invite you to come in, and so we can just everyone at once share and get the same information. Any other questions?
I had one more question over here in Taylor County. John Moore, Central Kentucky News Journal. Tying back into the food thing, not necessarily spreading it through food, but food service, retail, and hospitality businesses. What steps do they need to take to ensure that their employees are not spreading illness? I know that these are typically lower paid jobs that don't offer sick leave and stuff of that nature. I know the governor has called on them to offer sick leave, but we don't see any signs of that happening here locally.
We would certainly encourage them to ask their employees to stay home if they're sick, if they have a fever, to stay home. There's some other things that maybe my environmental director just in general might be able to say, so I'll give him a chance.
I just want to echo what Sean said, that we would encourage those places to provide sick leave for the employees that are sick. At this time, we do want people to be excluded from food service if they're a food worker, a food handler, if they have a fever. That is actually a procedure that we operate from at all times for any foodborne illness. But in this case, we know that even though COVID-19 is not a foodborne illness, we don't want a sick person come to work and then infecting a person that is just a patron of that restaurant. So.
Plus, we have about 5 minutes left, so we might have time for maybe one or two more questions. So
we have a question in McCreary, please.
Okay, McQuarrie, go ahead.
Hi, Greg Berg, McCreary Voice. I'll make it quick. Circling back around to one of your first statements, we all know this is a very fluid and dynamic situation. You said you have no confirmed cases in the region and you've had testing. Can you speak to how many people have been tested and how many outstanding tests are there? So like you could get a result back tomorrow morning from the lab that does test positive.
Amy, can you answer that? How many people from our district have been tested and how many are outstanding?
We have only sent off one specimen. We've done one test on an individual that we were concerned enough about to request a test on, and that was negative. We have no pending tests at this time. We do have people that we have been notified by from the state who have maybe had travel history or something like that, that they have asked us to reach out to and monitor and keep kind of in contact with. Some people that meet those criteria, maybe we are asking them to stay home and not go out in public as much and just monitor themselves, for signs and symptoms and that kind of thing. I don't know exact number of those, Amanda, maybe you know better, but I would say a handful of those at this time.
Thank you.
You're welcome.
All right, one more question and then we'll have to wrap up. We've got a coronavirus to be responding to, so we're going to have to get off and do some response instead of some media communication. So one last question. I don't see one last question. So with that in mind, thank you all very much. I hope this has been helpful. I will meeting with my Department Operations Center Monday, and we will be talking about how the events went today and ways that we might keep you all better informed so that you can help us keep the public better informed. So thank you all very much and have a good day and God bless.